Albert, are you ready?
Absolutely, I am. And ladies and gentlemen, I am uh, overjoyed with the ability to introduce our speaker tonight, Dr. Payam Sajedi, who has a very interesting background from the perspective of the Baha'i faith. Baha'u'llah often likens the various religious messengers to instruments of the most great physician. This description of God as an individual who can uniquely diagnose humanity's problems and then prescribe a remedy through individual revelations is something very apt. Baha'u'llah specifically also mentions in something that can be seen as a prophecy. There's an amazing quote where he says, "Strange and astonishing things exist in the earth, but they are hidden from the minds and the comprehension of men. These things are capable of changing the whole atmosphere of the earth, and their contamination would prove lethal." There are some Baha'is who see this as purely a spiritual message, but there are some Baha'is who might take it literally and say that this foretells of nuclear power and nuclear energy. So interesting tonight that we have a doctor whose entire field is based on this power prophesied in this day. Dr. Sajedi is a Maryland native and a second generation Iranian American, always inspired by the sacrifices of his parents. He's currently a neuroradiologist, but he has made a life trying to serve a community and future generations. I'm very interested in what he has to say about understanding human suffering from a scientific and a spiritual perspective.
Albors, the check is in the mail, my man. That was that was incredible. Thank you for that. And I'm just going to share my screen and begin momentarily here. And Alex, everyone, can you see the PowerPoint?
Yep. Yes.
Perfect. All right. So thank you so much for joining me today. My name is Payam Sajedi, and the title of my talk is Understanding Human Suffering, Bridging Science and Spirituality. And really, kind of where can I start with this topic? This is something I've been circling around the majority of my life, just kind of wanting to learn more, having the urge to learn more about suffering, but often resisting because of this desire to, frankly, avoid suffering altogether. But as a physician, there is this constant exposure to individuals experiencing suffering. They look to us to help alleviate their ailments and their suffering that comes with that. And although this sentiment of wanting to heal others is what inspired me to want to be a physician, when I was confronted and witnessing on a daily basis this degree of suffering in my training and my schooling, it took a serious toll. While so many of my school colleagues would kind of convey this sense of empowerment by their patient interactions, I would often come home and kind of ruminate and dwell over these cases. Their pain was becoming my pain, and their suffering was becoming my suffering. A question I would often ask myself would be something like, why is this innocent person suffering? How is it fair that this 30-year-old doting mother who just welcomed a second child into this world gets this diagnosis of this terminal, incurable cancer? What's the meaning of this? I felt an anguish really that I could not process. And cases like this kept me up, knowing the limitations of medicine, right? That so many diseases lack a definitive cure. And beyond that, what about our inherent fallibility as humans, as practitioners? Ultimately, after reaching, a lowest of points, I decided it was time to confront my own suffering and to educate myself more on this topic and to find purpose in it. And as a scientist and as a Baha'i, it was important for me to really learn about suffering from both perspectives. And so I just want to take you along with me in this journey of what I've learned. And just a brief outline here, just we'll begin by exploring what science teaches us about suffering. We'll transition into more of a faith-based approach about suffering, mostly focused on the Baha'i faith, but also incorporating some teachings from other religions. And then we will wrap up by discussing how the combined efforts of science and religion can provide us with solutions to dealing with our suffering. And although there are some slight variances in the definition, between the articles I've read, a fairly comprehensive and integrative definition that I encountered in the Journal of Pain by the No-Steinmuller group defines suffering as a severely negative, complex, and dynamic experience in response to a perceived threat to an individual's integrity as a self and identity as a person. It's important to note that pain, the word pain, is not actually in this definition, right? Pain can be a source of suffering, but it's not the only one. Social circumstances, for example, like poverty, or social isolation, non-painful illnesses, and mental health issues, they're all examples of potential inciting factors for suffering. What else do we know about suffering? We know that everyone is potentially exposed to it. Everyone will be exposed to it. It's ubiquitous, right? Regardless of your age, your gender, your culture, your profession, your wealth. We also know that suffering can take on a physical or emotional state, or potentially both. And we'll expand on that momentarily. From a neuroanatomy standpoint, scientists have come to understand that there are distinct pathways, actually, in which an individual can perceive pain and suffering. The lateral pathway, which we see here in the left image, highlighted in blue, actually helps us localize and determine the intensity of a pain stimulus. And that's in contrast to the medial pathway, which allows us to process emotional and sensory aspects of pain. And neuroscientists believe that this is the pathway that's responsible for us acquiring this feeling of suffering. What research has also shown us is that the brain processes social forms of distress, such as rejection and social kind of isolation, similarly to physical injury. And here we have actually images from a functional MRI where brain activity can be measured and detected by changes in blood flow. And in one scenario here on the right with physical pain, basically a physical pain stimulus is incited to the patient and uptake is seen in specific areas. In this case, you see it in the cingulate gyrus and the frontal lobe. On the left here, we have a different scenario where in this scenario, individuals were exposed to a scenario where they were told that they were to be isolated. They were excluded from a game. And again, uptake was seen in a similar location. So there's overlap between physical and social forms of distress. And I find this particularly interesting because as humans, we are much easier, we're able to conceptualize and sympathize often more with individuals that are experiencing physical pain, right? More so than social and emotional pain because we can see it, right? We can see it firsthand. But this study and many others that support this one just go to show that the brain is impacted, again, similarly by both physical and emotional forms of pain and suffering. In medicine, there are also examples of how emotional suffering can manifest with physical symptoms and vice versa. Here in this example, we have a condition called Takotsubo cardiomyopathy, also known as broken heart syndrome. And although the exact etiology is still being studied, this condition has often been associated with patients who have recently experienced a particularly stressful event, such as the death of a relative. And what happens is there's this rapid weakening or dysfunction of the left heart chamber, the left ventricle, and particularly in the systolic or contracted state. And the heart forms this abnormal shape where you see those arrows outlined. And the initial kind of authors who described this condition thought it looked like an octopus pot. So that's why they called it, Takotsubo cardiomyopathy. But again, this is a case of an individual experiencing emotional stress typically, and it's manifesting with physical symptoms. There are also examples of individuals experiencing physical pain and suffering that manifest with mental health symptoms, right? Just revisiting our very exciting neural pathway discussion from earlier. In addition to that lateral medial pathway, there's an additional pathway called the inhibitory pathway, which actually helps us suppress pain. Unfortunately, in the case of chronic pain, this inhibitory pathway becomes less effective, and it causes a significant increase in sensitivity to pain stimuli. Ultimately, this chronic pain, in addition to factors like stress or unpleasantness or catastrophizing, which is basically kind of exaggerating, right, the consequence of an outcome, leads to suffering and ultimately forms this negative feedback loop. That suffering ultimately has been shown to lead to anxiety and depression. Chronic pain, by the way, is extremely prevalent. About 20-30% people in our population experience chronic pain, and it's considered to be the major cause of human suffering worldwide. So in this, my hope in kind of sharing this brief overview of the science of suffering is to provide just a glimpse of what suffering is and how suffering functions from a biologic standpoint. But that still leaves the big question of why. Is suffering merely a biologic response, a form of natural selection, a consequence of our environment, or does it hold a deeper meaning and purpose? Let's explore that a little bit more in the second portion. But before I do that, I did want to distinguish two major categories of suffering. There is the so-called consequential or self-inflicted suffering, which is suffering in which we experience as a result of our own actions or choices, right? Our own free will. For example, a gambler who puts his house on the line in a bet and loses that house and therefore becomes homeless. And that in contrast to involuntary suffering, right? Suffering that takes place without our conscious choice, such as receiving a cancer diagnosis or being in a car accident or being exposed to a natural disaster. Okay, so again, most of the discussion on spirituality and suffering will revolve around what I've garnered from reading the writings of the Baha'i faith, but again, I will try to incorporate some additional insights and traditions as well. Through my exploration of the Baha'i writings, my ultimate takeaway is that suffering always provides us with an opportunity for spiritual growth, whether it's self-inflicted or involuntary suffering. And that involuntary suffering is not a coincidence, and it's not a punishment, but rather a necessary form of adversity brought to us by God. So although it may feel like torture when we're exposed to this suffering, these tests are actually a token of God's favor to help instill spiritual development. And just if I could share this quote from Baha'u'llah, the prophet founder of the Baha'i faith, who speaks to this. O son of man, my calamity is my providence. Outwardly is fire and vengeance, but inwardly it is light and mercy. Hasten thereunto, that thou mayest become an eternal light and an immortal spirit. This is my command unto thee. Do thou observe it. It's often only when adversity knocks on our door that we're reminded to be introspective, live through those growing pains, right? And reflect on how we can improve ourselves. We're taught that the soul grows through these difficulties in the same way that the body grows stronger through exercise. And to that effect, Abdu'l Baha, the eldest son of Baha'u'llah, states, the mind and spirit of man advance when he is tried by suffering. The more one is tested, the more one's capacity increases. The more the ground is plowed, the better the seed will grow, the better the harvest will be. In this passage, our souls are likened to the ground, right? Our soil that's being refined to allow for growth, all with this ultimate purpose of enriching and perfecting our souls for the next world. To further reinforce the fact that involuntary suffering is not a punishment, we can just reflect on the lives of the prophets, right? The manifestations of God that have come before us. If you recount their stories, all of them have endured immense suffering on behalf of their cause. And here is just some commentary from the Bahá'í writings which attests this suffering of the prophets. Abdu'l-Bahá states, other sufferings there are which come upon the faithful of God. Consider the great sorrows endured by Christ and by his apostles. Those who suffer most attain to the greatest perfection. And as Corey shared earlier from Shoghi Effendi, the guardian of the faith, but suffering, although an inescapable reality, can nevertheless be utilized as a means for the attainment of happiness. This is the interpretation given to it by all the prophets and saints who, in the midst of severe tests and trials, felt happy and joyous and experienced what is best and holiest in life. Shown here on the left are some images from the infamous prison called the Sial Chal, or the Black Pit, that Baha'u'llah stayed in for several months and was forced to wear these heavy chains around his neck. But it was in these terrible, unlivable conditions where he received the revelation that he was the manifestation for today. I also wanted to share this quote from Abdu'l-Bahá. The wisdom of the appearance of the spirit in the body is this. The human spirit is a divine trust, and it must traverse all conditions. For its passage and movement through the conditions of existence will be the means of its acquiring perfections. Just reflecting on this quote, it to me is a reminder that we must prepare ourselves for any and all situations, right? Good and bad, outwardly joyous and turbulent in our lives, with the aim of perfecting and refining our souls, right? Maybe we can kind of liken our souls to gem miners, right? That are sifting through souls to life's soil, and perhaps going on these treacherous hikes to discover these kind of metaphorical hidden gems, right, or these virtues. So what are some of the virtues that can be developed or enriched or harnessed from suffering? Here are just some of the few that I can think of, some of the many, but just highlighting a few. When we endure and overcome hardship, we gain the tools for detachment. We often find this confidence and resilience in reflecting on what we have overcome. And potentially there's a coming of age moment, a maturity where we are able to kind of better distinguish what's important and what's not in our lives. And of course, compassion and empathy. We're able to better understand and relate to the pain of others. Aggregating these virtues, right, or help prop up our soul and help us attain this nearness to God that every faith-based individual desires. And I'm very much a work in progress when it comes to learning the perspective of suffering from other traditions, but I did find that there was a very similar theme of endurance and character building related to suffering, as demonstrated in these passages from, for example, in Christianity, in Romans, it states, we rejoice in our sufferings, knowing that suffering produces endurance, and endurance produces character, and character produces hope. In the Quran, it says, we shall test you with fear and hunger, and loss of wealth and lives, and fruits, but give glad tidings to those who patiently persevere. I also want to incorporate the Old Testament there in this particular book, of the book of Jobs, which is entirely devoted to this notion of suffering. And For those of you that don't know the story, just to summarize as best that I understand it, it tells the story of an inherently good person whose name is Job. And as the story goes, Satan confronts God, and he states that Job is only a good person because he leads a life of comfort. He has wealth, a great family. And so God allows Satan to test Job. Job in subsequent, in subsequent order loses his wealth, his family, and his own personal health. He suffers terribly, but he never loses his faith in God. His friends assume, they confront him, they say, you must have sinned, you must have done something terrible to deserve what's happening to you. And he objects, he says, no, I haven't. And he stays, again, committed to God. And ultimately, God speaks directly to him and conveys that God's wisdom is beyond comprehension, right? Because he is questioning why is this happening, but he's not rejecting his faith. And ultimately, as stated in this passage, the Lord restored the fortunes of Job when he prayed for his friends, and the Lord gave Job twice as many as he had before. And you'll notice that those passages provided in the Quran and in the Bible also kind of echo that similar sentiment, right? Of that pain and suffering and overcoming and that character building. In Buddhism, one of the central themes is the discussion of suffering, right? Dukkha, which is roughly translated to suffering, is actually one of the first noble truths taught by the Buddha. And Buddhist belief is that suffering is the result of our attachment to outcomes. Modern Buddhist philosophy incorporates this equation of suffering equals pain times resistance. We know that we can't really control, right, often the source and intensity of the pain that we're confronted with, but we can control how we respond to it, right? If we distract ourselves, right, with a means of avoidance, of superfluous distractions, of kind of forms of abuse, alcohol or drug, whatnot, we are resisting pain, right? But as we diminish our pain, as that factor of resistance diminishes, and we allow ourselves to sit in our discomfort and pain and process, subsequently our suffering can improve. In Hinduism, there is this concept of karma. It's a term that we've all likely heard of, but there are some variable interpretations to it. My understanding is that every action has a consequence. And similar to Buddhism, self-interest, right, often leads to attachment to outcomes, and that attachment leads to suffering. And once we're able to detach ourselves, we're able to liberate and realize our true selves. In my exploration of suffering, I also found this, of course, just to reiterate, we found this constant reminder that, from the different, holy books, that suffering is painstaking, right? It's necessary and it's ultimately beneficial. I also found, interestingly, that we're constantly reminded that suffering does not exceed our capacity, which to me provides reassurance that we are inherently built to overcome our pain and suffering. No matter what the crisis is that we've been exposed to, we have the tools and resources to get past it. From the Quran, it says, Allah does not burden a soul beyond that it can bear. In the Bible, it says, no temptation has overtaken you that is not common to man. God is faithful, and he will not let you be tempted beyond your ability. But with the temptation, he will also provide the way of escape, that you may be able to endure it. Baha'u'llah says, God hath never burdened any soul beyond its power. So if I were just to remove these parentheses and play this game of, who said it, it's all could be interchangeable. You could say it could be all from any different faith, right? And likewise, we're also reassured that in different faiths as well, that suffering is transient, it's temporary. Baha'u'llah says, should prosperity befall thee, rejoice not, and should abasement come upon thee, grieve not, for both shall pass away and be no more. In the Quran, it says, verily with hardship comes ease. In the Bible, it says, and after you have suffered a little while, the God of all grace, who has called you to his eternal glory in Christ, will himself restore, confirm, strengthen, and establish you. There's so much overlap, right, between the perspective in these religions as it relates to suffering. It's not merely coincidence from a Baha'i perspective. It's a confirmation that the spiritual essence of each religion is one and the same. I would be remiss if I also didn't provide some insight and thoughts or provide some writings, passages from some of the most influential minds in our time. Rumi says, the wound is the place where the light enters you. Nietzsche says, to live is to suffer, to survive is to find some meaning in the suffering. Socrates says, if you don't get what you want, you suffer. If you get what you don't want, you suffer. Even when you get exactly what you want, you still suffer because you can't hold on to it forever. Your mind is your predicament. The late great Kobe Bryant said that the fears that we have, the moments of suffering, they're all part of the process. They're all part of growth. It's nature. You don't run from those moments. You embrace them. You have to embrace the storms. Interestingly, not only does spirituality help provide us with purpose in the face of difficulties, but it also provides us with potential therapies to help alleviate, to treat suffering. And while several of these therapies are well incorporated into secular practice, you'll find that they all have their roots in spirituality. For example, yoga is very much has its origin in Hinduism, meditation in Hinduism and Buddhism. Prayer, of course, is incorporated into every faith. And community and fellowship, while certainly not exclusive to religion, provides us still with that forum where individuals can gather, right? Support, uplift one another, and that inherently evokes a positive feeling. And in the title of this slide, you'll notice the word complementary. That is to say, for me, I'm not of the opinion that the solution, the only solution for pain and suffering, are these below described therapies. In fact, of course, I believe medication has a very important role in treating pain and suffering. And often these forms of therapy can be combined, right? Complementary to provide an optimal outcome. And in fact, in the Baha'i writings, it states that religion and science are the two wings upon which man's intelligence can soar into the heights with which the human soul can progress. It is not possible to fly with one wing alone. Should a man try to fly with the wing of religion alone, he would quickly fall into the quagmire of superstition. Whilst, on the other hand, with the wing of science alone, he would also make no progress, but also fall into the despairing slough of materialism. And to just paraphrase a portion of this passage again here, if we just rely on religion alone, right, we can fall into superstition. Therefore, it's important for us to kind of test these spiritually inspired therapies and make sure that they're corroborated, right? These ones that we've mentioned here, make sure that they can be corroborated through the means of research. And so I just attempted to do just that. I spent some time just kind of looking up article after article to see if, in fact, these spiritual forms of inspired forms of therapy do have credence in literature. And so I incorporated, copy and pasted some of the citations here. But in meditation, for instance, there's dozens of articles that have been written overwhelmingly supporting that meditation can reduce our chronic pain and other factors that help that can contribute to our suffering. Researchers have even honed in on the breath control, right? That's often performed in meditation, and noted that it can help engage that part of our autonomic system that helps us rest and digest, to help relax. It's also been shown to help improve our attention. It's improving our neuroplasticity. And, I kind of briefly went over this term of the cingulate gyrus, which is like a kind of gyrus that's in the brain. That's a center where, potential forms of suffering are kind of processed. And meditation has been shown to actually help kind of improve our change activity in the cingulate gyrus, potentially changing the way that we're perceiving and processing suffering. Likewise, yoga has been shown to be very promising as an integrative therapy in reducing symptoms of depression and anxiety, and just generally helping improving feeling of well-being. Prayer is a more challenging topic for a researcher to study. In part, there is traditionally that dichotomy, right? That distinction between science and religion. So there is that potential bias. But also because the practice of prayer can vary significantly between any two individuals, right? It's hard to study when there's that much variation. With that said, studies have definitely shown that those who engage in consistent prayer do have lower rates of anxiety and depression compared to the general population. As it relates to intercessory prayer, or that, praying on behalf of others, the data has been a little bit more kind of conflicting and difficult to prove. What it has shown, although it hasn't been shown to necessarily improve the physical health of the person that is being prayed for, again, it has been shown to improve the anxiety of the individual that is praying. And, there might be a further wisdom to this. Abdu'l-Baha tells us that sometimes a prayer will not be answered if it's not in accordance with God's will, right? Or if it doesn't benefit us. So a little bit more challenging to study that. Research has also shown us that those that felt they're part of a community have had improved mental health symptoms, decreased anxiety and stress, often attributed to feeling connected and supported. And a great example of this is the Alcoholics Anonymous program, which is spiritually inspired by Christian principles. And it's been shown that those who commit to the program have about twice as their abstinence is twice as high as anyone else, as the general population. And that's thought to be really related to kind of having that support system. One final thought before I wrap up. I just wanted to contribute this additional piece, this additional foundation to this bridge between the science and religious perspectives on suffering. There is this theory called the post-traumatic growth theory. It's a phenomenon that was identified in the 1990s by psychologists. And basically what they learned through their research was that survivors of trauma or really, really challenging situations often recognize and embrace new opportunities. There were five main categories of growth in which they identified. One was a greater appreciation of life. Another was improved relationships. Another was new possibilities, personal strength, and in fact, spiritual change was also cited. Just another example of potential harmony between science and religion. So, all this to say, what I've learned through this process of studying suffering from both the spiritual and science lens is that really suffering is inevitable and an often necessary condition, which ultimately can result in our betterment if we approach it, accordingly. Whether that suffering is, again, involuntary or consequential. Suffering is truly a reminder and a guide. I'm no longer trying to run or escape from suffering. I have a better understanding of it. And although the suffering of others still does impact me, I am able to process it better through this journey. And through it, I also found a confirmation in witnessing and studying these complementary components of science and religion, and the overlap, really, between religious perspectives. So with that, I'll open it up to all of you and ask where this leaves you.